and essentially said, your only history is that stroke, but you have these anterior ST elevations, and I'll show you what that looks like on EKG, because it's important for you guys to know. But they said, all right, so your heart has 3 big arteries. There's 2 on the left, 1 on the right. The one on the right kind of goes back behind it. The 2 on the left kind of go in front of it. And so this one, your left, one of the 2 left looks pretty good. This one, it's medium size, it has a branch, but everything else looked fine. This one though, the other left-sided one, is large, but it has a thrombotic occlusion, which is a fancy way of saying big old blood clot in that artery, which is what caused your heart attack. The right looked fine. It's medium size, there's nothing going on in it. And so essentially what they did was, well, first they put in a balloon pump, which is like, that was to support your blood pressure. And that was what was going through your groin. Do you remember that?
Yeah.
Okay. So there's this large clot in this artery, probably an organized blood clot, and they essentially tried to do this export catheter, which is a fancy word for a vacuum, like a big straw, to try to suck this clot out of there. And they tried that a couple of times, but it didn't work fully. Heavy thrombus burden remains in the LAD. So they said, we're going to keep you on this super fancy blood thinner called Integralin. We got the balloon pump in there. We're going to do a heparin drip, keep you on all these blood thinners, and then we're going to see. So they take you back to the lab. They do not. Did you only go back the one time?
Yes.
No more procedures that you remember?
Yeah.
Okay. Here's the discharge summary. So you saw Dr. Iyengar and Dr. Mastroni, who are both very good. So this is what they mean. This is where that big clot was. This is sort of all the same problem here: the STEMI, the heart attack, and then the clot there. So they only were able to get a little bit of that clot out. Aspirin. And then while you were there, things got even weirder. Blood clots went to your spleen and to your kidneys. Do you know what I'm saying that?
Yeah.
Man, this got weird. This is wild.
Yeah.
So essentially they did the another echo, and that showed that there was a blood clot at non-compaction, ventricular circulation. 4 days low Lennox with a bridge. TEE should L be non-compaction with stasis. So the heart wasn't squeezing great. I'm sure they told you. It was down to 25%. Normal is greater than 50. It was a little bit down, which is from TE should apical trabecular smoke, and then have apex non-compaction stasis. Warfarin with hope, discharge. Okay, so let's digest this. You had a big heart attack, but it's different than most heart attacks. Most heart attacks happen when somebody has what we call a plaque, this cholesterol plaque in the artery that ruptures. Yours was, by the looks of it, all blood clot. And you've had other blood clots in your brain with these strokes. And then you had blood clots go to your kidneys and to your spleen. So your main issue is blood clot. They're going all over the place. Sometimes they go to your brain. Sometimes they went to your kidneys. This time they went to your heart, and it caused a heart attack, but a very unusual kind of heart attack. So the root cause of all this is the blood clots.
Right.
Now, where are the blood clots coming from? The thought is that they're coming from the left side of your heart. So they think that when they did this study, this TEE, the echo, the ultrasound, but in the mouth and down, and they thought that you have some LV non-compaction, which means that it doesn't squeeze great. And I'm going to show you the, let's see if we can find the TTE. Here's the TEE. So this was the 19th, sorry. So this is when they go in. Here's what they see. The left ventricle is normal in size and thickness, looks normal. The function is definitely down, the pump is down. Remember, normal's 50 or higher, yours is 25. And then they see this thing. So they see this prominent apical trabecula and smoke. And smoke is what we call, so smoke is sort of swirling blood that looks like smoke on this. It's not smoke, obviously, but it looks like you or I would see if you saw it. You'd say, oh, that looks sort of smoky. And that's at the very tip top of the heart, way out here, They said they see this smoke. They don't see a blood clot in that chamber, but they see the smoke, which is sort of a little bit like that. There's no thrombus in the left atrial appendage, interatrial septum appears intact, and now atrial septal defect, injection, nothing, pericardial fusion. Okay. What else do we do? Do we do the cardiac MRI, LV? Level hypokinesis, left ventricle, regional ultrasound schematics, there's interest. Let me read one more thing here. I'm trying to get the best picture that I can get here.
Okay.
Because this is anything but straightforward. Just very, very unusual. You just had a birthday a little bit ago, huh?
Yeah.
Happy birthday. Sorry, it's been a busy month.
I was actually released
on your birthday.
On my birthday, yeah. Went out, had some drinks.
That's
reasonable. Nah.
Yeah, well, I was going to say, if anybody deserves it.
No, yeah, I went home and
you had a bad month,
down.
My friend. That was a bad month.
Yeah.
We need to see what the blood doctors had to say. That's my next place to look.
Okay.
813, severe abdominal pain. So that's a couple of days after you got admitted. And they took you for the scan and showed infarcts, blood clots throughout some of the belly. Do you remember that happening? Hematology consulted and hemoglobinopathy testing in addition to ALPS and PNH testing were negative. So this testing here
hemoglobinopathy,
and then this antiphospholipid syndrome and paroxysmal nocturnal hemoglobinuria. Those are conditions that folks can have that would make their blood prone to clotting. So for you, that's the big question. Is something going on here causing you to clot and causing all these issues? 10 years ago, is that why you were having those strokes? Now, is this why you had the heart attack? Now, is this why you had the infarcts to the kidney and to the spleen? That's the question. They're saying that the testing was ordered and it's negative, that your blood's actually normal. Ultimately, TEE showed LV non-compaction with evidence of stasis within the ventricle. Tribulations were thought to be cause of thromboembolic disease rather than a primary hematologic abnormality. So what they're saying is this. Let me break this down because this is going to get kind of weird. The left side of your heart, the part that pumps blood out to the body. So your heart has these 4 chambers. It has 2 top chambers, which are like kind of little wimpy chambers, and then it has like 2 really big bottom chambers that are big and muscular.
Okay.
So the biggest one is this one, the left ventricle.
Okay.
And that part, this part of your heart, is what pumps blood all over the body. Okay. So that's the major big pumping chamber. Now, this is where they saw that smoke, was over here. And so the question is something going on with this chamber that's causing blood clots to form somewhere in all that smoke that they're seeing? That's the $1 million question. Because what they're saying is that your blood is normal. You have normal blood. You don't have blood that's trying to clot, for instance.
Okay.
So it's coming from somewhere else.
That's really weird.
It's really strange. This is a very strange thing. So that's the best guess right now, is that these clots are forming in the heart and are getting pumped elsewhere. 10 years ago, they got pumped here. A month ago, they got pumped here and here. And that's why you're on the blood thinner now.
Right.
Is to prevent clots from forming here, which I think is the right thing to do. And I'm glad you're on the blood thinner.
Okay.
Do you have any family history of heart disease?
Not immediate family.
Okay. So mom, dad, brothers, sisters.
Mom, dad.
And nobody with heart stuff.
Nope.
And you're a young man still, but when you were young, you played sports, were active, no issues.
Yep, absolutely.
Nothing like that.
Nothing.
Interesting. Up until this summer, were you doing okay? Active? Being
This
able
summer,
to be fine?
This summer I was doing fine. Yes.
Doing fine.
Everything was fine.
You go up flights of stairs, no problem.
Yep.
Walk around the block, no problem.
I felt great. Well, maybe I was out of breath because I was smoking cigars.
Yeah.
But
nothing crazy.
Yeah.
Nothing where you're like, man, I can't do anything. I
Yeah.
can't go up a flight. You could do normal stuff.
yeah. Exactly.
Okay. So that's the let me see what they got here. Sorry, guys. We're going to go through the med list here in a second, but
Okay.